Cefaclor Suspension, Reconstituted is a type of antibiotic that is used to treat various bacterial infections, including those in the middle ear, skin, urine, and respiratory tract. It works by stopping the growth of bacteria in the body. It's important to note that this medication only treats bacterial infections and will not work for viral infections, such as the common cold or flu. It's also important to use this medication only as prescribed, as unnecessary use or overuse can lead to decreased effectiveness. Make sure to take the medication as directed by your healthcare provider and at the recommended dosage. It's best to take it at the same time each day to ensure consistent levels of the medication in your body. Before giving Cefaclor Suspension, Reconstituted to your child, make sure to shake the bottle well. This medication can be taken by mouth with or without food, as directed by your doctor, usually every 8 or 12 hours. If your child experiences stomach upset, they may take this medicine with food. For the best results, it's important to take this antibiotic at evenly spaced times. Try to take it at the same time every day to help you remember. Continue giving this medication until the full prescribed amount is finished, even if symptoms improve after a few days. Stopping the medication too early may cause the infection to come back. If your child's condition lasts or gets worse, be sure to inform your doctor. If you experience stomach upset, headache, nausea, vomiting, or diarrhea, it's important to let your doctor or pharmacist know. However, many people using this medication do not have serious side effects. It's important to contact your doctor right away if you experience any serious side effects, such as nausea/vomiting that doesn't stop, stomach/abdominal pain, yellowing of the eyes or skin, dark urine, unusual joint pain, new signs of infection, easy bruising/bleeding, signs of kidney problems, or mental/mood changes. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. If you experience symptoms such as diarrhea that doesn't stop, abdominal or stomach pain/cramping, or blood/mucus in your stool, it's important to contact your doctor immediately. Do not use anti-diarrhea or opioid products if you have these symptoms, as they may make them worse. Prolonged or repeated use of this medication may result in oral thrush or a new vaginal yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. A very serious allergic reaction to this drug is rare, but it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist for further guidance. Before taking Cefaclor, it's important to let your doctor or pharmacist know if you have any allergies, especially to penicillins or other cephalosporins. This medication may contain inactive ingredients that can cause allergic reactions, so it's essential to discuss this with your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have kidney disease or intestinal disease, colitis. Cefaclor may affect the effectiveness of live bacterial vaccines, such as the typhoid vaccine. Make sure to inform your healthcare professional that you are using Cefaclor before getting any immunizations or vaccinations. Before undergoing surgery, it's crucial to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Cefaclor should only be used when clearly needed. It's essential to discuss the risks and benefits with your doctor. This medication passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Cefaclor Suspension, Reconstituted, as they may affect how the medication works or increase the risk of serious side effects. This includes both prescription and non-prescription drugs, as well as herbal products. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important to note that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much Cefaclor Suspension and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. This can be done by calling 911 or contacting a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include severe vomiting and seizures. It's important to remember that Cefaclor Suspension, Reconstituted, is prescribed specifically for your current condition and should not be shared with others. It should not be used for another infection unless instructed by your doctor. Be sure to follow your doctor's recommendations closely to ensure the best results. If you forget to take a dose of Cefaclor Suspension, Reconstituted, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose and take your next one at the usual time. Do not take a double dose to make up for the missed one. When taking Cefaclor Suspension, Reconstituted, it's important to follow the label instructions on whether or not to refrigerate it. Make sure not to freeze it and do not store it in the bathroom. If there's any unused portion after 14 days, it should be discarded. It's crucial to keep all medications away from children and pets. Additionally, do not flush medications down the toilet or pour them into a drain unless instructed to do so. It's important to properly discard this product and it is expired or no longer needed. If you have any concerns about how to dispose of it, it's best to consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.